Do you know what pneumonia is and how it affects your lungs? This common respiratory infection inflames the air sacs in one or both lungs, which may fill with fluid or pus. This can lead to symptoms like coughing up phlegm, fever, chills, and difficulty breathing. Pneumonia can be mild to severe and affects all ages, but it's particularly dangerous for infants, young children, older adults, and people with weakened immune systems. Now, what causes pneumonia? There are a few culprits. Bacteria like Streptococcus pneumonia are common causes. Viruses, including influenza or flu viruses, respiratory syncytial virus, and rhinoviruses, can also lead to pneumonia. Fungal pneumonia, though less common, can occur in individuals with weakened immune systems. Symptoms of pneumonia can include a cough that may produce phlegm, high-grade fever, chills, shortness of breath, especially with exertion, sharp or stabbing chest pain that's exacerbated by coughing or deep breathing, fatigue, and in older adults, confusion. If pneumonia is suspected, a healthcare provider will conduct a physical examination, listening carefully to the patient's lungs with a stethoscope for abnormal sounds. A chest X-ray is often used to visualize the lungs and identify areas of infection or inflammation. Blood tests can help determine the type of infection, whether it's bacterial or viral. And a sputum test, examining a sample of mucus coughed up from the lungs, can help identify the cause. Treatment for pneumonia can vary based on its cause. If the pneumonia is bacterial, antibiotics are prescribed. For viral pneumonia, antiviral medications are used. Over-the-counter fever reducers like acetaminophen or ibuprofen can help reduce fever and alleviate discomfort. Cough medicine can help relieve cough symptoms, and for individuals with severe symptoms and difficulty breathing, oxygen therapy may be necessary. Preventing pneumonia is possible through several measures. Vaccines are available to prevent pneumonia caused by certain bacteria and viruses, including the pneumococcal vaccine and the flu vaccine. Regular hand washing and covering the mouth and nose when coughing or sneezing can help prevent the spread of respiratory infections. Finally, maintaining a healthy lifestyle through a balanced diet, regular exercise, and adequate sleep supports a strong immune system, which is key in fighting off infections like pneumonia. To summarize, pneumonia is a common respiratory infection that affects the air sacs in the lungs, causing symptoms like cough, fever, chills, and difficulty breathing. It can be caused by bacteria, viruses, or fungi. Diagnosis involves a physical examination, chest X-ray, blood tests, and a sputum test. Treatment can include antibiotics, antiviral medications, fever reducers, cough medicine, and oxygen therapy. Prevention includes vaccination, good hygiene practices, and maintaining a healthy lifestyle.